this video, we'll be comparing delirium with the dementia. So first we'll be focusing only on the delirium and then we'll move on to the dementia. So let's talk about a delirium. So delirium, it is a presentation, is a hallmark, is the impaired consciousness. So the main feature is nothing but the impaired consciousness is the main feature. Then where is it commonly seen? The delirium is more common in case of the children. In case of the children as well as it is present in the elderly. So in both cases they can be seen. Then we'll focus on the associated physical findings. So what are the physical findings of this? The physical finding, it includes the acute medical illness. So there can be presence of the acute medical illness can be seen. This is in case of the delirium. And there can also be presence of the autonomic dysfunction. There is autonomic dysfunction. And there is presence of the abnormal ECG as well as there is carpophagia. There is carpophagia or the flocculation. So this is nothing but the picking movements at cover sheets and clothes. So it is a picking movement of the at cover sheets or clothes. Then we are going to look at the psychological findings. So what are the psychological findings? So psychological findings, there is a impaired consciousness as seen. So there is impaired consciousness. Then there is also the illusion and the delusion. There is a illusion as well as presence of the delusion. Next comes the sundowning. So there is the sundowning, and this is nothing but the symptoms much it worsens at night. You need to know that it worsens at the night. Then we are moving on to the course of the delirium. So what is the course of the delirium? The course of delirium, it develops quickly. So the delirium, it develops quickly and there is a fluctuating course. So there is fluctuating course and it has lucid intervals. Thus lucid intervals LI, and this includes the waxing and the waning. So there's waxing as well as the waning. Next we look at the etiology, that is seeing how it is caused. So etiology of this delirium is that it can be due to the CNS disease. It can be due to the CNS disease, that is it can be the Huntington's. It can be due to the Huntington's. It can be due to the Huntington's disease as well as the Parkinson's disease. Next we look at the CNS trauma. So other cause can be the CNS trauma, then the CNS infection. So CNS infection, it can include the meningitis. Then we will look at the systemic diseases. Systemic diseases, it can involve the hepatic system as well as the cardiovascular. Then comes, it can be due to the substance abuse and the withdrawal. Then we have the HIV infection and also the prescription drug overdose. So we have the prescription drug overdose. So example here is nothing but there is atropine. Next we move on to the treatment aspect. So how is the treatment of this delirium? The treatment is by treating the underlying medical cause. So you treat the cause. So this was about the delirium. Now we'll compare it with that of the dementia. So how is it different from the dementia? So how does dementia present? So dementia, it presents as a loss of memory. That is nothing but the loss of memory. And there is intellectual abilities. The loss of memory and the intellectual abilities. Next we'll look at where is it commonly seen. So this is commonly, it is seen in the elderly. It is commonly seen in case of the elderly. So then we move on to the associated physical changes. The associated physical changes. So associated physical changes, it includes, there is no medical illness. There is no medical illness. Then there is little autonomic dysfunction. There is little autonomic dysfunction, as well as there is a normal EEG which is present. Next we'll move on to the psychological findings. So what happens in case of the psychological finding? So the psychological finding in case of the dementia, it includes, there is a normal consciousness. Next, there can be a depressed mood. Then the personality changes in early stages. So there can be personality. So there can be personality changes. This happens in case of the Pick's disease. So early stages of the Pick's disease. Then there is sundowning. So there is sundowning. So this symptoms, it worsens at night. Then we will focus on the course. The course, what does it include? The course is, it includes, there is a insidious onset. The course is that it includes an insidious onset, and this is all in dementia. Then there is a progressive downhill course. There's progressive downhill course. Now, what about the etiology of the dementia? So the etiology, that is the cause, it can be due to the Alzheimer's disease, then a vascular disease, that is about 15 to 30% can include the vascular diseases. Then comes, there is also the CNS. The CNS diseases, that is a Huntington. So it can be Huntington as well as a Parkinson's disease. Then we look at the CNS infection. The CNS infection is nothing but there is a HIV as well as the prion diseases. Then there is also the Lewy dementia, Lewy body dementia. Then comes the Pick's disease. The Pick's disease, it includes the frontotemporal dementia. It is nothing but the FT dementia, that is a frontotemporal dementia. So this was about comparing the dementia. So we saw the etiology of the dementia. Now, lastly, we are going to see how do you treat this. So treatment of this dementia is by, so let's see how to treat. So the treatment is by, you administer the acetylcholine esterase, EC inhibitors. So that is, it includes a donepezil. Then comes a rivastigmine, and also the NMDA antagonist. So the NMDA antagonist. So they are some of them. So example here is memantidine. So this was about comparing the delirium and dementia, and we saw various headings through which we can differentiate them. So to learn and grow daily like this, please do subscribe.